Here in Kampala, this being a rainy season, mosquitoes are breeding right now. In 2014, WHO estimates that Uganda reported 13.2 malaria cases. Think for a minute. Uganda has a population of approximately 48 million people. That means 1 in every 4 people has malaria. That's too big a number to ignore. Why? You can be that 1 person among the 4 with malaria. In the next 5 minutes, I'm going to guide you how to protect your family from malaria. Stick to the end for that number 1 mistake people make with treatment. Malaria is caused by Plasmodium parasites. We get it or we get them when we get bitten by an uninfected female Anopheles mosquito. We do not get malaria from cold or rain or eating mangoes on a rainy day. That is a myth I will bust later on. This being a rainy season, it means we expect lots of stagnant water. And lots of stagnant water mean lots of mosquitoes breeding. Places like Kampala, Rubaga, Kawempe, with poor drainage, or any other area with poor drainage, we expect lots of stagnant water. And this makes such areas risky zones. Speaking of risk, we have groups of people that are at risk of getting malaria. 1, children below the ages of 5 years. This is because their immunity is still developing. People living with HIV/AIDS, their immunity is low. Pregnant women. When you get malaria and when you're pregnant, you're at risk of a miscarriage or giving birth to a low-weight baby. Travelers, people coming from malaria-free areas to Uganda, which is endemic. They're at high risk of getting this malaria. When someone gets malaria, within 10 to 15 days following a mosquito bite, there are signs and symptoms to look out for. The early ones, we have fever, chills, we have headache, and sometimes sweating. But hey, this is the classic sign I would like you to watch out. A fever that comes and goes after every 2 to 3 days. In children, they can experience vomiting, they can experience poor feeding, or even convulsions. But here is the red flag you should never ignore. If you see yellowing of the eyes, difficulty breathing, or confusion, you need to rush to the nearest trusted health facility. That could be severe malaria. When malaria is not treated early, it comes with complications. 1, cerebral malaria. This means the parasites have migrated and reached the brain, and they can even cause coma. Severe anemia. This means that the parasites have ruptured your red blood cells and you're at risk. Next is organ damage, and there are 2 key organs at play here. We have the kidney and even the liver. But even then, malaria can also lead to death, and this is common in children and pregnant women. Self-medicating with coartem without testing leads to drug resistance. Never treat any fever as just a malaria minus a test. While at Masapharm pharmacy, always ask for a rapid diagnostic test, commonly known as an RDT. Results are out in less than 15 minutes. If that's not possible, you can do a microscopy, and this is done by a lab where we look for malaria parasite, the Plasmodium parasites in blood. When the test is positive, then you have to manage that malaria. And when it is uncomplicated, WHO recommends that we use artemisinin-based combination therapies. One being artemethyl-lumefantrine. Commonly on market we have coartem. Take it with a fatty meal like milk for better absorption. I need to caution, you need to finish the dose to prevent resistance. You should also add on some supplements to boost your energy and your blood. We have a number of blood tonics on market. We have the likes of Hemofort, Ferroglobin, among others. In case malaria is severe, then you have to get some injections. And the common injection is artesunate. For the case of the pregnant ladies, always seek guidance from a healthcare provider. Why? Some drugs are not safe in the first trimester. I do not recommend use of herbal mixtures alone. Why? They delay healing or treatment of malaria. This being a rainy season, I want you to look at this rainy season checklist. 1, sleep under a treated insecticide mosquito net. Government of Uganda is giving out some, but even here at Masapharm, you can walk in or order online via our website and get yourself some. You should always wear long sleeves shirts, should wear trousers in the evening. But if you cannot do that, then you should apply a mosquito repellent on the exposed parts to chase away mosquitoes. We have quite a number on market. We have the likes of Genamos here at Masapharm. We have the likes of Mosquito. We have the likes of Willet, Ballet, among others. You should clear stagnant water around your houses, your homes. They harbor mosquitoes. These are the breeding places for mosquitoes. Broken bottles, tires, or gutters. For the pregnant women, you should keep taking what we call FANCIDA, intermittent preventive therapy. You should consult with your doctor before you start. It's normally taken once a month. On a good note, Uganda has also introduced a malaria vaccine for the children below the ages of 2 years. I encourage parents to take their children for such routine vaccination against malaria. Malaria is preventable and treatable, but only if you act early, because it can actually kill. If you or your child has a fever, do not guess. Visit Masapharm Pharmacy for that quick malaria test and expert guidance on management of malaria. Masapharm Pharmacy is open 7 days a week.